Hi doctors, my name is Dr. Luslamo and the topic today is the Vena cava. The superior and inferior vena cava are collectively called the Vena cava. There are veins that return the oxygenated blood from the body into the heart, the blood emptying into the right atrium. In this video, we can see how the blood gets to the right atrium from the inferior vena cava and superior vena cava, and then move to the right ventricle, from there to the lungs, return to the left atrium, to the left ventricle, and the blood goes back to the whole body to repeat the cycle. The inferior vena cava travels up alongside the abdominal aorta with blood from the lower part of the body.
Inferior vena cava, we have the hepatic somewhere in there, and then we have the adrenal lumbar vein. Then we have the renal vein that branches off to a gonadal vein. On this side, we also have another gonadal, continues down to the iliolumbar, and then we have the common iliac, which goes down to the external iliac and the internal iliac. This is the deep femoral, and this is the femoral vein, which branches off to the saphenous and the popliteal.
The superior vena cava is above the heart and formed from a convergence of the left and right brachiocephalic veins that contain blood from the head and the arms. Health problems attributed to the inferior vena cava are most often associated with it being compressed or stripped. In rare cases, straining associated with defecation can lead to restricted blood flow through the inferior vena cava and result in cycle. Some pros and cons. The pros, for example, walking, balanced diet, and exercise. And some cons are obesity, triglycerides, sodium alteration, diabetes mellitus, and hypertension arterial. In Ecuador exists an important exam, the inferior vena cava ultrasound. The primary utility of bedside ultrasound of the inferior vena cava is to aid in assessment of the intravascular volume status of the patient. This may be of particular utility in case of undifferentiated hypotension or other scenarios of abnormal volume states, such as sepsis, dehydration, hemorrhage, or heart failure.
A phased array transducer with a cardiac exam type is used to perform an inferior vena cava ultrasound exam. The inferior vena cava is evaluated at the level of the liver and diaphragm. The transducer is placed to the right of the epigastric midline with the orientation marker to the patient's feet. As an alternative approach, this exam may be performed using an abdomen exam type with the orientation marker to the patient's head. The liver, diaphragm, right atrium, and inferior vena cava are identified in this view. Sweep from side to side to differentiate the inferior vena cava from the aorta. The aorta is thicker walled and pulsatile. The superior mesenteric and celiac branches of the aorta are identified at this level. The inferior vena cava is thin-walled and changes caliber with respiration. The diameter of the inferior vena cava decreases with inspiration and increases with expiration.
In this exam are some findings: the volume depletion and volume overload. The volume depletion. In this patient, the diameter of the inferior vena cava will be decreased and the percentage collapse will be greater than 60%. With complete collapse, the inferior vena cava may become difficult to visualize. And the volume overload, some patients weigh Increased intravascular volume will have a large inferior vena cava diameter and minimal collapse on expiration.